Thank you. All right, we got a couple. A wonderful couple coming up next that is near and dear to the foundation because they've been around since the foundation. Dr. Daniel and Elaine Furst.
Yay!
Yay! How are you guys holding up?
We're clapping for Justin. What a good job.
He was really good. I got to tell you. Good on you.
Yeah, you grab his album. It's smooth. It's really smooth.
Oh, our daughter used to play alto and bari.
Oh, there you
go. We appreciate sax music.
Good.
Hey, listen, I wanted to thank you for having us on. Yeah. You know, we clearly are the token medical couple on here.
Of course. You missed out on all the patients earlier. We had like 5 patients come up.
Neat. Well, you know, we're not Dr. Fauci. Sorry. No. Can't quite make it.
You're much better.
But, you know, we try and keep up, and we'll try and help out.
Definitely. So the reason I wanted you guys to come up is basically a lot of people still don't understand what scleroderma is. And as much as I can explain it, I'm no authority on it, just a witness. But you've pretty much written the book on it, like literally have a name on the book that says what is scleroderma. So Dr. Furst, can you please give us a little rundown, a real quick one?
Sure. So scleroderma is an unusual, not rare, but unusual disease. And it's one of those diseases which we call autoimmune diseases, where the body turns against itself. We have a genetic background. We have certain things that can cause it, like there are certain kinds of mining activities, even certain foods that are associated with it. And when we have it, when the patient has it, it attacks a lot of their organs, their lungs, their heart, their GI, gastrointestinal tract, their kidneys, their muscles. And so they can be pretty darn sick. I'd say that, you know, the worst 5 or 10% of the patients are as bad as most cancer patients. And the patients, they're good people and they work very hard to maintain their lifestyle. But with this disease, which causes scarring in all of their organs, it really can make them sick. Short of breath, irregular heartbeats, fatigue, joint pain. And we're learning about it. We really are. We're beginning to have some treatments for it, but we need so much more help. And the patients need the help, and we'd love to have you help us help them.
That's awesome. And real briefly as well, too, I mean, everybody's concerned about the coronavirus. And, you know, like they say, if you're relatively healthy, young, it's weird that I'm still in the young bracket. My wife was like, great, we're still young. That's a great news. But especially for scleroderma patients, explain how it's just so much more crucial that we, you know, abide the whole stay at home and social distancing.
Yeah, let me do this a little differently, if you don't mind. I want to kind of, first of all, you know, where do we get the information we use? Well, we get it from the clinic, from the CDC. We get it from the Scleroderma Foundation. We're just putting out an article with a bunch of people from all over the world. We got people from Italy and Serbia and China and the United Kingdom and Japan and Switzerland. We all put together an article, which we're going to publish soon, on what scleroderma patients need to do. But, you know, we need to think about not only scleroderma patients, but everybody. So what are the 3 most common symptoms? You may have heard this before, but nearly 100% of patients get fever. About 75% of patients get cough. And about 50% of patients get short of breath and they get achy and tired. So if someone has this, it feels just like the flu. However, if that flu lasts a little longer than we'd like 5 days or so, you probably ought to get looked at, particularly if you're a scleroderma patient. That is, someone who's got an underlying disease and is on immunosuppressive medications. You know, talking to the scleroderma patients, when you go in to see your doctor, make sure they know you have that other disease, scleroderma, and those drugs, because they'll treat you and look at you differently. Really important, okay? I think a lot of people would like to know, when is this darn thing going to be over with? So what do we think? The data seems to show that in the United States as a whole, we're going to get to the peak in 4 to 6 weeks. Some places earlier, some later. And then things are going to straighten out and kind of flatten out for a while. And the decision to allow people to do more things is really going to be a political one. When 50% of the country has been infected, only then are we going to be beginning to see it go away. So we figure it's going to be at least 2 or 3 months. So bottom line, if you have flu-like symptoms and they last more than 5 days, you better seek some help and let them know your underlying illnesses. Okay?
Thank you, Dr. Furst. See, I didn't know about the whole 4 or 5 days. I'd be like 104, I'm straight to the hospital, but I guess that's not going to happen anytime soon.
You know, the other thing, what do you do? What do you be careful about? Well, you just said it. You know, we know isolation, washing, all that stuff. Here's something you didn't know, I'll bet. We touch our faces 90 times a day.
On average.
What?
And that's what spreads exactly. That's what spreads it around. You know, touching the eyes, stuff like that. You know.
Wait a minute. Can you why the eyes are important not to touch? How do you get that disease from touching your eyes?
Yeah. Well, you know that the virus spreads on droplets of liquid. It doesn't go through the air. It has to be on liquid. And we have tears in our eyes. So when we touch those tears, even indirectly, then it goes down through the tear ducts, back to the back of the throat, and by God, we're into the lungs. So that's why you got to keep away.
So the droplets go through the air and they land on places like your fingers, your clothes, your surfaces. And then you touch them and then you touch your face. Okay, I have to go wash my hands now. I have to go sing happy birthday twice.
There you go.
And there's another thing that I think we ought to talk about, and that is treating this COVID-19. Right. Everybody would love to have a treatment. And there's been, I'd say right now, there are 101 clinical trials in the world trying to find a treatment for it. And the ones that we heard mostly about are about a drug called Plaquenil or chloroquine. And the data are really iffy. One trial is good, a better trial is not. The trouble is that it's life-saving for other diseases like lupus. And so if we use up all that hydroxychloroquine, these people are going to die. And so we really got to be careful about using a drug without proven data. So for a hydroxychloroquine and stuff, really not. There is a drug that is being used that actually may help. It's called Actemra. It's used in rheumatoid arthritis. It's used in scleroderma, a number of other diseases. And it turns out that when you're really sick, something called a cytokine storm starts. Also, the protein get loose. And Actemra acts against those proteins. So in China, it's being used in the very sickest patients. Turns out, by the way, that scleroderma patients use it a good deal because there's some data to support it. So they've already been treated. I think the question comes up, should I take more? If a little's good, is a lot better. No. Stay with it. Don't go higher. Other drugs, stay with it.
Well, what about, so if I'm already on these drugs, just leave it alone.
Yeah, if you're on these immunosuppressives, if you're on these kind of drugs, don't stop them. Stopping them is more likely to do more harm to your underlying disease than the likelihood of COVID giving you trouble.
Right. And so what about zinc and vitamin C?
That's a good question.
Thank you.
Yeah, it's a good question. So it turns out that, vitamin C helps with the common cold. Zinc helps with the common cold. We have no data that it helps with this. On the other hand, it's pretty safe. So if you want to take something, those are the things you might want to try. And don't scratch your nose. I'm sorry.
It's itchy.
What was this?
I haven't been out for 14 days. I'm sure I'm safe.
And the other thing is, what about prophylaxis? That is, if you don't have it, can we prevent it? The best thing is the stuff we know, right? Prevent it by keeping away from others, et cetera, et cetera.
And wash your hands.
And wash your hands.
A lot.
A lot. There is nothing that tells us there is any medicine for prophylaxis, so don't waste your money or time. Okay? So I've given you a whole bunch of stuff.
That is awesome. I mean, that's what people are waiting to hear, especially for an authority like you with an actual medical degree.
I got to tell you, there's someone who does a lot of stuff who's got her own degree, and she might be able to help a little bit too.
Yes. You may see her on Jimmy Kimmel Live and Miss Elaine Furst.
The late show with James Corden.
James Corden, that's right. And Bones and several other. Hey, isn't that Grandma Elaine?
Yeah. So I'm a triple threat. I'm a hyphenate. What Dan is talking about is my interest is in how people behave under stress and what the body does under stress. And I can tell you, because Dan and I are sheltering at home, that I don't know if I can handle 4 to 6 more weeks of this. I really don't. But what happens to people is that we get very creative, or we start taking it out on each other, and especially if you're scared. So, boredom's going to happen, and my thought is go with it. Sleep, watch the TV, read some books. There's all sorts of wonderful things on the internet. Somebody came up with adults sheltering in place bingo, which is very cool. And if you have kids, you're already busy. So we're just in it for the long haul. This is not something we're used to. I mean, how are your guys doing it at home?
We're doing a streamathons. That's what we're doing. No, I mean, our kids were scheduled for spring break right before the lockdown. We had camping plans. We had travel plans. We were going to go to Vegas, the whole 9. And then this thing came crashing down. So, I mean, the good thing is that we're all homebodies. Well, at least the rest of the family is. We're downloading video games and everybody's hanging out. Next week, they start school. So that's going to be the big change for us. I know everybody else just jumped into school, which is, it's sort of like jumping in the pool and getting used to the water real quickly. Our kids are having to adjust back from vacation and jumping into new form of school. So it's a learning curve. The good thing is my kids are highly technical and they can figure out websites. Yeah, and most kids are, but now we're going to be having to deal with the math. the questions, and we're like, oh, we shouldn't have cheered on Common Core that much. But
your guys go and find their friends online and have a Zoom conference. So could you do a math class?
Well, that's what they're doing. So our district, Glendale Unified School District, is doing 1 week of just like straight assignments, where they'll do it and they watch a video and then they do it, and then the week after they'll go into the Zoom classrooms. So at least there's a transition. I know a lot of school districts didn't have that advantage, but you can't just toss everybody in there, because even the teachers are going crazy. They're like, I have to clean my office because I have to teach from it. They didn't figure out how to use the virtual backgrounds. So it's a whole learning curve, and everybody's managing.
I think we're getting a lot of creativity, really good stuff, and it's on the web, and there are good places to go. Boredom is not an absolute requirement, quite honestly.
No.
By the way, there's something else I wanted to point out. When we talk about the COVID-19, that's a typical what's called SARS virus, a coronavirus, which is like SARS and is like MERS, that stuff that occurred about a year ago. The good news is that although it's really more contagious, it's much less dangerous. So far, worldwide, the mortality rate is 2%. Compare that to SARS and MERS, which was 9.5% to 10%.
Yeah.
And what I don't understand is how come we're locking down now, and a year and a half ago, all this stuff was going on with these SARS and MERS, and nobody locked us down. So I don't get it.
I do think the difference is that this is spreading so much more rapidly than that.
Okay.
People
are more scared.
Yeah, and a lot more people are getting infected. So,
well, I think it's also a preventive, isn't it? In order to keep us from going up to the numbers that SARS and MERS went up to, we're locking it down now. So it's a nice little social experiment.
It is, in totally a very strange way. Well, listen, is there some other stuff that you guys want to ask about the COVID stuff?
Well, what they're going to be doing is they'll be asking it in the comments right now. So, like somebody's asking, Lori is asking, if you've been already quarantined for 14 days, are you still not allowed to touch your face?
It's actually a good question. If you've been truly quarantined, that is, you haven't gone out shopping, you haven't done any of the stuff where you could get reinfected, you are no longer going to have a problem.
If she's had it.
If you were really good about it. Have a good time picking your... No, wait. Have a good...
You heard the doctor. Picking your nose is safe during quarantine times. Well, thank you so much, Doctor and Elaine. It's, you guys are truly friends and very supportive for me and my family. And thank you all for sharing the information. A lot of people are getting so many different things coming on different sides, and to be specific for scleroderma patients, this is wonderful.
Yeah, and don't forget to donate to Scleroderma Southern California.
No, don't.
Right down there, scleroderma.org. Help SoCal, please.
All right.
Woohoo!
Thank you, Doctor. Thank you, Elaine.